Hello, I'm Dr. William Berger, founder and owner of Northeast Medical Practice in Great Neck, New York. We are an internal medicine, weight management, and aesthetic medicine practice. And today I would like to introduce one of our patients, and she is kind enough to volunteer to give a testimonial with regard to her weight loss journey in our weight management program. So I'll let you take the lead.
Yeah. Hi. So my name is Lil. I go by Lil, and I've been a patient of Dr. Berger's for I think 6 months now, maybe a little longer. And I've lost 10 pounds, which has been really neat. I don't know. It's been a good journey.
Good. So you're one of my star patients with regard to how attentive you are to your lifestyle. So let's talk about that a little, and let's talk about it by component of the pillars of lifestyle medicine. So let's talk about diet and nutrition, what you do, how you keep yourself on track, and just tell us a bit about how you approach your diet and nutrition.
Yeah, definitely. So in terms of diet and nutrition, something that I do, I'm vegan, I'm fully vegan, and I do a lot of whole food plant-based diet stuff. So instead of grabbing a bag of chips, right, I'll grab cucumbers and carrots and fresh whole raw vegetables, which is something that I absolutely love. It's something I've always loved, but my relationship with food hasn't always been great. And but now it's way better. It's that full lifestyle change. When you're looking at diet, it's not, if you look at it as a diet, it's harder to adhere to. But if you look at it as a lifestyle change, it's way easier to maintain going forward. So that's sort of what I do. I, supplement with a lot of protein. I look at protein, I look at calorie content, sometimes I look at carbs. And you want that lower calorie, high protein profile. With nutrients, you're always looking at the nutritional profile too, and the vitamins that are a part of it. High fiber is pretty good. And maintaining water. Water is super important. That's something that I do all the time. I'm known for drinking gallons of water.
Good. I approve of that too. So tell us how you were able to initiate that change, because it's very difficult for many humans, patients otherwise, to make changes in lifestyle in general, to break old habits and start new ones. So how were you able to make the change from when, as you said, your relationship with food was not the best, to where you are today?
I think a big piece of that is examining the relationship itself, right? So it's not a matter of that diet piece. In order to make a lifestyle change, you sort of have to get sick of what's going on in your life. And then you got to be like, I'm over this, I want to make a change, I want to make a difference, but sometimes it gets really hard. And having friends and family that can support you, finding, there's group therapies that you can be a part of, and speaking with health coaches, and really maintaining that quality care, I think, is really important. And something that your practice offers that is very different from everyone else's is that personalized quality care. And I think that makes a really big difference in, actually committing to a big lifestyle change that involves exercise and diet, and, it's the whole picture, as opposed to, I'm just going to go on this bad diet and that's going to be it and it's going to solve all my problems. If you're not well educated on that, or if you don't have that personal touch, it feels more like a routinized machine as opposed to this personal care. That's a big piece of it. And it feels like it's a private practice. It's very family oriented. The reception's incredible. You're incredible, but I'm very biased in that now that we've been in this doctor-patient relationship for this time. It's invaluable though. It's something you can't get at, major health scenarios. It's more like a machine, right? And that made a big difference for me.
Well, this is the reason that I left that environment. It was a world-class hospital system, but all the restraints and shackles that go with that in terms of productivity quotas and short periods of time with the patient and so forth. So thank you so much for your kind words with regard to our practice. That really is our mission, to provide the highest quality of care, take the time with the patient, because that's the only way to really provide the best medical care. So thank you again for your kind words. So how about the exercise, movement, physical activity piece? What do you do? How were you able to make those changes? How were you able to stick with those changes?
So a big piece of that is the gym that I go to offers classes, which is awesome. They have weekly classes, so it keeps you sort of accountable, and those classes happen on the weekends as well. So, you know, let's say you go out on Saturday and you're hanging out with your friends and you're having a big dinner or whatever, you might want to go to bed a little earlier, drink a little bit more water, because early you're going to have this class. So that sort of keeps you accountable. I do have a handful of friends that also go on this fitness journey with me, that we like to go to the gym.
Well.
Yeah, we like to go to the gym together, which is fun. But finding scheduling is usually an issue with us, right? So then what do if it's just me, right? I do a lot of walking, I do a lot of lifting in general, and find what I like to call opportunities for exercise. So let's say you have an option to take the stairs or the elevator, it's only a couple floors up, always take the stairs. If you're parking, right? You can park either right in front of your job or you can park a little bit further away. Those are minor opportunities for exercise. If someone needs something, run upstairs or something, be the person to run up the stairs to do that for them. So finding those little moments
That's
for
actually
opportunities.
exceedingly important in obesity medicine. You know, of course, in medicine, we need to have a term for everything, right? So we call that non-exercise activity thermogenesis, or non-exercise activity time, or NEAT. For short, but you've given a synopsis of it beautifully, and the only thing I would take issue with is I don't think it's minor. It can actually, if you're dedicated and attentive to it throughout the day, you can burn about 500 calories throughout the day by just increasing your general movement and maximizing that NEAT component. So definitely not to disregard dedicated exercise time, but that general movement piece is very valuable, not just for cardiovascular health and not being sedentary, but also in terms of just burning additional calories, because as you know, it takes a fair amount of work to burn 500 calories in a short period of time in the gym, and much easier to overheat those gains in terms of decreased calories. And so, how you're also utilizing some medication. You've just started on that process. In particular, if you don't mind, it's with Zepbound. So, how has your experience been with that? You're a couple of doses in. How do you feel like that integrates with the really good and dedicated lifestyle plan you have for yourself?
So it definitely makes a huge difference. It decreases appetite, which is pretty neat. But it really reforms, again, that relationship with food, right? It's like, without that, you could still eat, but if your body is full, you're not going to want to eat anymore. And so if you continue to eat, if you continue to, eat junk food or snacks or whatever it is, there's something there to look at. And that's, I think, a key indicator that this medication provides is, if you're not physically hungry, why are you eating? And that gives you an opportunity to actually reflect on that, which has been huge, right? And it's like, what are you putting into your body? That's super important too. But when it comes to the medication, I feel more, this is gonna sound weird, but I feel more alive. Like, I feel more active in terms of energy. Like, I wanna move more with this medication. And I'm not sure if it's the dedication piece of it or the minor changes that I've made or the major changes that I've made to my lifestyle, but it's like a snowball. Once you get that ball rolling, it gets more and more and faster, and then these sort of lifestyle changes become solidified in that routine. So yeah, the medication's been huge for me. It's made huge in terms of my PCOS and lots of other stuff that I go through. It's managed that tremendously, and I've been able to get off of other medications that were hindering my health, which has been pretty neat.
Right, and that's how I look at medication. It's a tool to be used always as an adjunct to proper lifestyle change. And you're only about more or less a month and a half into medication use, so you're still low dose. I don't think you already shared numbers, but how much have you lost thus far?
I think I've lost about 10 pounds.
10 pounds, okay.
Yeah.
So, and that's a reasonable rate of weight loss. We don't want it to be too rapid. It causes additional muscle loss. It can put you at increased risk of gallstones. So, to have a gradual weight loss like this is really ideal. And this is what I hear from my patients with regard to these sorts of medicines, that the constant chatter in their mind about food, when's the next meal, what's it going to be, that voice may not become entirely silent, but it definitely isn't shouting as loudly as it did before. And I think that is the real purpose and role for these sorts of medicines, is to make it easier to stick to the lifestyle changes.
Yes.
And if we can, keep you on, maybe even just a middle level dose, we might want to do that. Some folks, we go up to the highest one to try to maximize weight loss, but sometimes it's not necessary. And I'm also of the mindset that the smallest amount of medicine, the lowest dose that we need is best. There's no reason to throw on additional medication. So I think your overall weight management picture with really good, clean lifestyle with a lot of physical activity, both dedicated and neat throughout the day, and a little bit of medication. This is kind of the ideal picture for a lot of patients. It's great if you can do it with lifestyle, but if you have something additional like PCOS as well, or if you have just a lot of that food and hunger chatter in the mind, it can be the best tool in the toolbox to allow your lifestyle to really be optimized. So any final thoughts you'd like to add about your weight loss journey thus far?
Yeah, I don't know. It's been a great journey. I'm very big on that lifestyle change piece as opposed to fad diets or even medications. They are tools, like you mentioned, tools in recognizing the relationships you may have with food, or in recognizing what you need to go forward, what's right for you. And yeah, I think that exercise, weightlifting in general, strength training is super, super important. It's a whole picture. It's not any one thing, right? It's not just diet. It's not just exercise. It's both. And then having a care team and support within your life is monumental in terms of potential for success.
We're very happy to be on this journey with you together.
Yeah.
We always like to look at it in a patient-centered way, that you're the expert on you, and we're here to help you optimize what's best for you.
Yeah.
So thank you so much for being willing to give a testimonial, share about your journey, your kind words about our practice, and we look forward to all the next steps in your journey.
Yeah, me too. It's been wonderful.
I'm so glad.
Yeah.
So, as always, you can reach out to our practice in Great Neck, New York. Again, we are Northeast Medical Practice. We're primary care as well as weight management and some medical aesthetics too. And our telephone number is 516-604-3418. You can always find us on various social media platforms and our website, northeastmedicalpractice.com. And we'll see you soon.